Hi guys. Today I wanted to talk to you a little bit about some medications that may have been prescribed to you by a dermatologist. I love when clients come in and say, "Hey, I've gone to see a dermatologist." And the reason I love it is because a dermatologist has gone to school for a very, very long time. They know the skin inside and out. I went to school for skincare, but I don't know the chemical sides of things. I don't know the medical sides of things. I can tell you what specific ingredients do for the skin, but I can't tell you, oh, this medication is going to target this, this, and this, which is going to change the acne to this. That's not what I went to school for. But I do research a lot when it comes to my clients. They say, hey, I'm on this medication, and this medication for this. You better believe by the time you leave, if I haven't already, one, printed out like all the information I could on that medication, and two, known what contraindications are for that medication, as why you're specifically on it, then you're crazy. I had one client, she went to a dermatologist not too long ago for some issues that she'd been having. We have been treating them, and unfortunately, normal, like a normal routine was not working for her. So she talked to a dermatologist, we got some new eyes on it, and they went ahead and got her what I can't do, which is prescribe medication. They prescribed her some medication to help with, one, her acne, and two, they also gave her some anti-inflammatory type medications as well. So she sent me a list and said, hey, this is the medications they put me on. And I said, okay, now it's time for me to start what I need to do. So all of this right here, and most of this is front and back, all of this is notes for just that one specific client. That's about, I don't know, half an inch thick. So she did get put on, and this one's a very, very common one, Spironolactone, or Spironolactone, according to the pronunciation. So that is actually used for a lot of PCOS clients or PCOS patients, which is polycystic ovarian syndrome. That's my platform. I love talking about it. I'm very forward with it just because I have it. So that actually is a diuretic. It helps with hypertension, and then mineral corticoid receptor antagonist. That one, a little bit above me, but I know what hypertension is, and I definitely know what a diuretic is. But this actually can be utilized in the tablet form. And this is just skincare side because there's a lot to this, but it could be used for acne vulgaris, which is pretty much quite a bit of acne, but on females. And then acne vulgaris it is not gender biased, but this specific medication is acne vulgaris for females. Or it helps with it. And it also helps with excessive body hair or facial hair on females as well. It's called hirsutism. And I do suffer from that. That's why you see a lot of waxing videos come my way, is because the Lord blessed me with the ability to grow a lot of facial hair. And apparently there's people who love watching waxing videos. So good for me and good for y'all, right? So this actually is used for hormone therapy for male to female transgender women. And if you have like Addison disease, they're not going to put you on it, most likely. As well as, let me see, hyperkalemia. I don't know what hyperkalemia is, but that's one of the things. Let's see. I kind of glanced over this a bit. When I was doing my research, I've done a lot on just 3 medications: Axone, spironolactane or lactone, and tretinoin. I know what tretinoin is. It's Retin-A micro. I understand what it is, but I like to know like very in depth what they're talking about. But with spironolactane, it talks about to basically stay away from excessive potassium intake. So like salt substitutes, low fat, low salt foods, bananas, nuts, those should be avoided. So when they put you on medications, please make sure you understand, and your doctor is not going to get mad if you say, hey, tell me about this medication. I need to know. That is what they're there for. And they absolutely, I'm sure they appreciate clients that that really want to understand their health. But so aspirin may diminish the therapeutic effect of this medication. And this is the thing that's kind of crazy. A lot of medications that I've seen, they have like their drug interactions, and it's like 3 or 4. This one is, it interacts with 1, 2, 3, 4, 5, 6, 7, 8. Well, holy cow. Um, 3 whole pages front and back. So like 6 pages total that it has reactions to. So make sure you understand and you are very forthcoming to your doctor when it comes to them asking you what kind of medications you're on. Even if you're on over-the-counter aspirin, that's still a very, very important thing for them to know, because aspirin could completely throw that off. Let's see. I'm trying to see. You'd think I'd know how to say this word. Dermatologic reactions, erythema. What erythema is redness. I suffer from erythema. If I get my eyebrows waxed, I am red, red, red. If I wax my face and my chin, I turn extremely red. If I get a chemical peel, I am the color of a tomato. So that's what erythema is. Rashes, Stevens-Johnson syndrome, toxic epidural necrolysis, and urticaria. What I am saying, I don't understand 100% of this, but you best believe by the time I am done with this piece of paper, it is going to be, hold on, to be continued. Okay, sorry about that. Anyway, I don't understand this paperwork all the way through, but I will literally work on this specific paper until I completely understand every single term, every single reaction. I want to know that medication inside and out. There is things in here that I do understand. It can cause fever. It can cause, erythema, that kind of thing. But there are terms in here that I've never seen before. So yes, I am going to definitely go through here and make sure that I understand this 110%. And that way, when I talk to my client the next time they come see me, which is in a week, that I can talk to them about this and they can fully grasp what they are taking as well. So it's talking about how gout can happen. I'm trying to read through this, I'm sorry. It says that it needs to be, your blood pressure needs to be monitored, serum electrolytes, potassium within 1 week of initiation. So within 1 week of taking it, your sodium needs to be checked, uric acid, glucose, renal function, and volume statuses. I'm sure that could be done on like a CBC. So just like a blood test. Transgender hormone therapy, serum testosterone levels every 3 months. This is just telling you what has to be checked if this is the way that you are administering it. Reproductive considerations. It can cause menstrual irregularities, which is dependent on the dose that you're taking. Contraceptive is recommended when used. If it's going to be used for like the facial hair and the acne. It can cross through the placenta if you are pregnant. According to this, they did some animal studies on this, and in utero, if you take this medication or in an animal, it causes feminization of a male fetus. There's not a whole lot of data on if that does that to humans as well. There are risks of birth defects and low birth weight, premature delivery, stillbirth, and neonatal death. It's used to get rid of extra fluid. It is used to raise potassium stores in the body, to treat heart failure, like for a weak heart. High blood pressure, it's used to treat some people with high aldosterone levels. To treat kidney problems. Diarrhea is one of the side effects, so is fatigue, headache, hair loss, nausea, vomiting, abdominal cramps, mood changes, confusion, muscle pain or weakness, abnormal heartbeat, dizziness, passing out, kidney problems, like the inability to pass urine, blood in the urine, how much you urinate in general, weight gain, liver problems like dark urine, fatigue, lack of appetite, nausea, abdominal pain, light colored stools, vomiting, yellow skin, severe dizziness, passing out, confusion, change in balance, decreased sex drive, chills, sore throat, menstrual changes, breast pain, enlarged breast in males. If you are having a significant reaction, it's like wheezing, chest tightness, fever, itching, bad cough, blue skin color, seizures, swelling of face, lips, tongue, or throat. And that's not even all of the side effects of just that one medication. You can find all of this information with a simple Google search. But to completely understand what kind of medications you're on is great. On my TikTok account, a lot of people are like, oh, you need to get on this medication. You need to get on this medication. You need to get on this medication. And they're telling all of these other women who have PCOS, that's what you need. Unfortunately, I'm going to say 99.8% of those people are not doctors. They don't know you specifically. They don't know your health issues. If you have any, if you don't, they have never seen any of your test results. So if you think that this is a medication that you need for your, like excessive facial hair or your PCOS or your acne, talk to your doctor about it. They can tell you whether it's a good match for you or not, or if something else is going to work better for you. There's a lot of people that know so much more than you do about you. And by that, I'm saying, you know what's best. Do what's best for you. And you don't have to listen to people online. I used to get so embarrassed all the time with my PCOS, and I didn't really think that I could ever talk about it publicly, but honestly, I can. I do get acne quite a bit. I did talk to my doctor yesterday about getting me on some medication as far as to clear out my acne, because I do the steps that I have to as far as skincare, but it hasn't really helped. So now it's to the point where I take it one step further and I go talk to my doctor. They did prescribe me some medications, in which you best understand I'm going to do a lot of research on them. But they put me on these medications, and so now I can possibly start seeing some differences, and definitely I will keep those documented. But yeah, I know I talked a lot and it's kind of rambling, and you're kind of learning as I learn. I will continue to do some information on spironolactone lactone whenever I get a better grasp of it. So that'll probably be my next video, is things that I didn't understand prior to just glancing over this. I also have Dapsone, it's a topical, and tretinoin, and then we'll go into the guidelines of care for the management of acne vulgaris, and then we will go into the evaluation and treatment of hirsutism in premenopausal women. I can't ever say that word right, so I'm always going to say excess facial hair, but hirsutism is actually just excess body hair in general. So thank you for joining me today. I hope you learned something, but I know I did. But anyway, thank you so much for joining me. I hope you have a wonderful day. Please stay safe. Make sure to wear your masks. Yeah, I'll see you next time. Thank you so much.